Hello and welcome back to this channel. Today we want to discuss about breast cancer, a very important topic, a topic of global concern. Breast cancer is an issue of global concern because it is estimated that 25% of women lose their life annually due to breast cancer. And statistically, breast cancer is also the second most common cause of cancer-associated death among women. Lung cancer is the first, and breast cancer is the second associated cause of high mortality rate among women population. And we'll continue to create awareness in the little ways we can, being it in the hospital settings, our homes, our workplaces, wherever, so that we can reduce the mortality rate and increase the survival rate of breast cancer if we detect the cancer at an earlier stage. Some myths out there about breast cancer include the following, and I'll be crossing them out with the facts about breast cancer. Number one on the list is small tumors always means better outcome or better prognosis. That is, people believe that once the tumor is small, it can easily be cured or it can be cured completely. This is not true. It is not true because better prognosis or a tumor detected at an early stage have better outcome, and that does not include the size of the tumor. The tumor can be small, but if it is not detected early, it can spread despite its size. So that is not true. Number two, men do not get breast cancer. This is not also true because men do get breast cancer. Men do get breast cancer because breast tissue is not an extraordinary tissue specifically found in female. Breast tissue is a modified sweat gland that is beneath the skin. So once you have a skin and you have sweat glands underneath it, when it is modified, then it accumulates on our chest area known as the breast tissue. So far as you have this sweat glands which can be modified, you can get breast cancer out of the modified sweat gland tissues that are now called breast tissue. Men do get breast cancer. Number three, injuries to the breast causes breast cancer. This is not true because breast cancer has no known causes. There are only risk factors, and the number of risk factors one has increases the person's chances of developing breast cancer. Injury to your breast can lead you to notice an existing lump that has been there, that if not for the breast injury, you wouldn't have noticed the lump. But the fact that you notice it after you got injured does not mean the breast injury causes the cancer. Injury to your breast tissue do not cause breast cancer. Breast cancer has no known causes. Your chances of developing breast cancer depend on the number of risk factors you have, which we'll be discussing later. Number four, mammogram cause breast cancer or spread breast cancer. Yes, we hear radiation cause breast cancer, but mammogram do not cause breast cancer. This is because mammogram uses very low level of radiation, and this low level of radiation is not enough to cause breast cancer or even spread it. Therefore, mammogram is an exception among the causes of cancer due to radiation. Yes, high rate of radiation or high level of radiation do cause cancer, but mammogram is not a known cause of breast cancer. The risk factors associated with breast cancer include the following, and I have grouped them into modifiable risk factors and non-modifiable risk factors. When we talk about modifiable risk factors, we are referring to factors that you and I have control over. We can do something to change them, or we can do something to limit our chances of developing breast cancer or cancer in general. And these include smoking, drinking alcohol excessively, diets high in cholesterol that are not good for our health, obesity or overweight, as well as lack of physical activity. So it's advisable that if your weight is over or if you are overweight, you should ensure some physical activity to moderate or to decrease your weight, because increased weight actually puts you at risk of not only cancer but other cardiovascular diseases. Environmental chemicals or toxins. Yes, the chemicals or toxins that are all over our environment, in our water bodies, in our foodstuffs, also increases our chances of cancer, breast cancer inclusive. Radiation, as I said earlier on, high rates of or high levels of radiation do cause cancer, but mammogram is an exception because mammogram has very low level of radiation. And these are the modifiable risk factors, things that you and I have control. We can decide not to smoke, or we can decide to drink alcohol in moderation. We can exercise to limit or to maintain our weight. We can also eat balanced diet. The non-modifiable risk factors also include the following. And non-modifiable means factors, or these factors you and I have no control over. We can't do anything to limit our risks of developing them. An example is being a female. If you are born a female, you are born a female. We cannot do anything about it. And that increases your chances of, or your risk of breast cancer if you are a female. Though men do and can develop breast cancer because they have breast tissue. Number two is age. Breast cancer is a very hormone sensitive cancer, especially it's sensitive to the hormone estrogen. And then postmenopausal women do develop breast cancer compared to premenopausal. When I say postmenopausal, I mean women who have stopped menstruating. This is because breast cancer is a very hormone sensitive cancer, especially the hormone estrogen. Estrogen influences the development of breast tissue as well as other female reproductive system. And then there is a system that connects your ovary function to your brain. So when you are menstruating monthly, that system puts the production of estrogen in check. So if the estrogen level is high, your brain will tell the ovaries we don't need too much estrogen again, and it limits its production. But when you go into menopause or when you stop menstruating, that check is disconnected. And besides the ovaries, there are other sources of estrogen production that comes into your bloodstream that are not under check by your brain. That is what we call peripheral estrogen sources, or peripheral conversion of androgen to estrogen. So after menopause, after menopause, though your ovaries are not producing the estrogen, the hormone, the peripheral source of hormone is still coming into your bloodstream. It means that, so in cases where your breast tissue decide to divide faster, cancer in general is actually the uncontrollable division of normal tissue. So when your breast tissue, your normal breast tissue is dividing out of control and is getting the estrogen from these peripheral sources, and there is no system to knock down the level of estrogen, it increases the division as well as the spreading. And that is the main reason why breast cancer risk increases in menopausal or as you age. Because as you age, estrogen by the ovaries is knocked down and the peripheral source is still going on unbalanced. So once the cancer sets in, there is no system to check or to limit its production. It gets out of control. Another non-modifiable risk factor is early puberty or early menarche. Menarche actually means the age at which a female child starts menstruating. So the acceptable age or the normal age for menarche or to start menstruating is age 12. So females who start menstruating before age 12 means that they start producing estrogen faster than normal age or normal acceptable age. And therefore, that high level of estrogen will continue to push and to influence the division of breast tissue as the child age, and it will get to a point that breast cancer risk increases. Also, late menopause, people who go into menopause after age 55 also have increased risks of developing breast cancer. Another non-modifiable risk factor is family history. So if you have first degree family member who has breast cancer, being your mother, being it your auntie, being it a sister, you should be concerned that maybe it is in my family line, so I also might have increased risks of breast cancer. Another one is genetics or DNA changes. There are some DNA changes we call BRCA1 or BRCA2. That those are genetic. You can inherit it if it is in your gene line, or you can inherit it if your mother has it. We call them BRCA1 and BRCA2 genes. And these are the non-modifiable risk factors that increases somebody's chances of developing breast cancer. I want us to note that it does not mean once my auntie has gotten breast cancer, I will also get breast cancer. My mother has breast cancer, I will also get breast cancer. If it is genetic, it might be the case, but if it is not genetic, your cancer, your risk of developing breast cancer increases based on the number of risk factors you have. So if a family member has breast cancer and also you have other risk factors, it can be modifiable or non-modifiable, then your chances increases compared to somebody who has just one known risk factor. I want you to note that if your mother has gotten breast cancer, it does not automatically mean you also get breast cancer. It can be so when the breast cancer type your mother has is a genetic type. Then it means that it can be in your DNA, and it's at the age in your life you can also develop breast cancer. These are the signs or the warning signs it might be breast cancer. Number one is a lump. So if you notice a lump around your breast tissue, a visible lump, or if it's something you feel, a lump you feel when you touch your breast tissue, then it's a warning sign. It can be a sign of breast cancer. Number two is skin changes. So if you are a white person and you notice that some part of your breast tissue is pinkish or reddish than the other, it is a sign it can be breast cancer. If you are a brown or a dark person and you notice that some parts of your breast tissue is darker than other parts, it is not a good sign. Another sign or another warning sign is nipple retraction. If your nipple is pointing out but is kind of dividing as shown in the picture below, it is not a good sign. With skin changes or skin dimpling, as shown in the picture, if you notice that some parts of your breast skin or your breast area is smooth and others part is looking like you've used a needle to perforate holes, it is not a good sign. Nipple discharge. If your nipple is producing liquid or secreting liquid and you are not breastfeeding, it can be bloody, it can be like milky, it can be yellowish or greenish. So far as you know you are not breastfeeding and you are seeing discharges from your nipple, it's not a good sign. Itchiness or itching, when your skin is around your breast tissue is itching, it's not a good sign. These are all warning signs that are of concern and you might be at risk of developing breast cancer. It is recommended that after 3 to 5 days menstruation, you should do self-breast examination to examine your breasts, to feel lump, to see any changes. And this recommendation is based on the fact that after 3 to 5 days, your estrogen level has declined, and therefore your breast, the women, they know what I'm talking about. Your breast is no more tender or painful. And when you are palpating, there are no false positive findings you will bring out. It's actually the right time, 3 to 5 days after your menses or your period. And it is recommended that we do this every month. Yes, self-breast examination should be done every month. Another thing that should be done every year or every 2 years is mammogram. But until the age of 40 years, mammogram is not recommended to individuals below 40 years because of the exposure to radiation we don't want to expose at an early age. And these are the recommended methods we are to follow when we are doing our monthly breast examination. Number one, you stand in front of a mirror exposing your breasts and you look in the mirror, looking at your breasts, are they the same? Is one bigger than the other? So it is advisable that as females or as women, get to know the sizes of your breasts, get to know the shape of your breasts so that when there is any change, you can notice that one is bigger than the other or one is smaller than the other. Secondly, raise your hands above your head and then you observe the under of your breasts, especially if your breasts are full breasts, bigger breasts. Raising your hands will expose the under part. You'll be able to notice any color changes, the skin dimpling I'm talking about, and then also the shape. After that, you raise one hand above your head. It can be your dominant or non-dominant. And with the other hand, you massage under your armpit to feel any lump. This is because the armpit is the first location breast cancer spread to, so it is recommended you feel that part. We come to the breast. There are two methods of breast examination: circular, and then vertical. The vertical means you start from up and then you feel down. You start from up, you feel down till you cover all area of your breast. Then the circular, you feel from the nipple. So you start from the nipple, the center, and then you feel outward. So you massage your breast, moving out, moving your hand out until you feel every part of your breast tissue. Then you come and do same for the other side, the other part of the breast. You can do this standing upright, or you can do this lying flat on your back, and then you do the same. At the end of this palpation method, then you press each nipple to see if there are any discharges. Sometimes there can be slight discharges. So if you see milky, if you see bloody, if you see yellowish or greenish, it's not a good sign. But if you press and you see a slight or something like colorless coming out, it is a normal finding. At the end of this examination, if you find any changes that are of concern, please, the first place to visit is go to the hospital. Go to the closest health center, give your complaints, and they will go further to do the mammogram, the x-ray, or they'll even do the needle biopsy. That will determine the type of lump you have. It can be harmless, it can be cancer. Once it is cancer, through the needle biopsy, they can also determine the type of cancer it is, the kind of treatments they will give you depending on how far it has gone, the stage of the cancer, I mean. So if you find any changes, being it alarm, being it pain, being it discharges, please and please again, don't stay home and consult herbal roots or consult prayer camps alone. Go to the hospital as early as possible. As it is said, early detection actually helps save life. So the earlier we detect a cancer, the faster or the better the outcome of cure. So if you waste time and the cancer spread to other parts of your body, it will be too late to combat the cancer or to cure the cancer without you losing your breast or your life. And let's help each other to save life. Early detection actually saves life. Love you all.